Good evening, doctors. Welcome again. Today we are going to discuss here about Neet PG 2021 memory based pathology MCQs. 10-year-old child, generalized edema, cholesterol is high 238, and urine protein it's 3 plus. Stool microscopy shows fat in stool. So this indicates nephrotic syndrome. Okay, so this is a case of nephrotic syndrome. Now, history of male child presenting with flexors right rosettes. His eye examination shows white reflex given the diagnosis is. So in this case, this is a case of retinoblastoma. Okay, direct one liner. Weak pulses in upper limb, BP 90/60, retinal hemorrhages present. So weak pulses or pulseless disease is another name of Takayasu arteritis. This is another name of Takayasu arteritis. Now, all increase in iron deficiency anemia IDA except TIBC increase, soluble transferrin receptors increase, iron protoporphyrin increase, but transferrin saturation is decreased in case of iron deficiency anemia. So this is the best answer here. Now, 20-year-old boy, gum bleeding and easy bruisability, fever for 1 month, for hemoglobin 3, TLC 1.5, it's pancytopenia, platelet 15, not a specific general exam finding except for the significantly paler due to anemia and petechial rash all over the body. Microcytes corrected, its reticulocytes is 0.5, not very high. Bone marrow fatty streak, absent megakaryocytes, no mature cells. So this is a clear-cut case of idiopathic acquired aplastic anemia, no PNH, and this is not a case of disseminated tubercular or myelodysplastic syndrome. Okay, now poor prognostic in multiple myeloma. In multiple myeloma lecture, I already explained the poor prognostic is beta 2 microglobulin indicates a poor prognostic marker in multiple myeloma. This is one liner. Familial HNPCC has a defect in. So this is also a one liner, and here is a defect of mismatch or repair gene. We can say mismatch and repair gene. This is the defect here. Now, 50-year male, complaints of fatigability persistent for 1 year, mild anemia, massive splenomegaly, hemoglobin 10, TLC 120 means 1,20,000, platelet 5 lakh, neutrophil 60, basophil 4, eosinophil 6, lymphocyte 15, myeloblast 3, rest mere myelocyte and bands. Ratio is 18/1. Most specific further investigation. So this is a clear-cut case of CML. In CML, the best investigation is FISH with PCR, you can say, and immunophenotyping is the investigation of choice in case of chronic myeloid leukemia. Now, patient presented with cirrhosis, liver biopsy showed eosinophilic material, cytokeratin positive, most likely composed of, this is one liner, answer is intermediate. If you know the answer, no need to think too much. Software engineer presents to the OPD with complaints of easy fatigue. He gives a history of sitting in front of computer 12 to 14 hours per day. He takes more junk food, less fruits and veggies. CBC hemoglobin 9, MCP high, it's macrocytosis, cause of anemia. So most common anemia, there is a confusion between folic acid and cyanocobalamin. So this is a case of cyanocobalamin, or we can say methylcobalamin, vitamin B12 deficiency. Why not folic acid? Because vitamin B12 is more common than folic acid. Okay. Now, 34-year woman presented with fever, migratory arthritis of lower large joints, tachycardia, murmur is pansystolic, mitral regurgitation, presents biopsy. So this is a case of rheumatic heart disease. So Aschoff bodies a pic is given, a shock bodies is the answer. Patient presented with fatigue, weight loss, infection, has history of 20-year benzene exposure last 20 years, fatigue, weight loss, and likely to have which cancer. So this is clear-cut case of bladder carcinoma caused by benzene. Okay. Pap smear with hyperchromatic nuclei, pleomorphism with low maturation index, almost all thickness. So this is a case of dysplasia. Okay, now patient with mediastinal mass was diagnosed with red cell aplasia. What is most probable cause of aplasia? Not respond to blood transfusion. So this is a case of mediastinal mass. Most common mediastinal mass is thymic neoplasia. Now, patient with general fatigue, tiredness, preclinical exam is uneventful, normal TLC, DLC, no immature cells seen, superficial discrete lymph nodes enlarged. On biopsy, effaced architecture, indented nucleus, prominent nucleus containing atypical cells, CD10 and BCL2 positive. If BCL1, then mental cell. If BCL2, how to remember BCL1? Mental, there is one L. In follicular, there is 2L, follicular double L. So 2, BCL2 positive. So answer is follicular. If BCL1 positive, that means mental. Okay, so guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask in a comment box. If you like this video, put like on it. Thank you. Good day. Goodbye. That's all.